I'm Dr. Richard Paulson. I'm a fertility specialist at the Keck School of Medicine of USC, where I have been practicing since 1986. In fact, I started the USC Fertility program in 1986, and now we are affiliated with HRC Fertility here in Pasadena. I went to medical school at UCLA, actually, on the other side of town, and did my residency at a place called Harbor UCLA Medical Center in Torrance. Then came to USC for the fellowship for the subspecialty training in reproductive endocrinology and infertility, and then was offered a position on faculty in 1986, and so I've been here ever since. When I started in 1986, IVF was brand new, and there were other parts of the fertility equation that were actually being investigated, such as the neural control of reproduction, and I was intrigued by that, by neuroendocrinology. However, I must say that once I saw eggs and sperm in a dish, and then embryos, and watched how they develop, and then watched how that transferred embryo can become a baby in someone's uterus, that is, to this day, the most fascinating aspect of the human existence, never mind of medicine. And so I feel very privileged that I get to work in this field. I would like to share my philosophy of patient care, and that is individualization, as well as a very deep dive into what it is that brought those patients to me in the first place. As someone that's been doing this for 35 years, a fair proportion of my patients come to me after they have failed literally everywhere else. And it is very gratifying if I'm able to solve that puzzle and figure out what perhaps other people have missed and which direction to direct that fertility care so that that individual patient or that couple can achieve their goal of completing their family. So individualized care is focusing on the patient, being involved with the patient, and also solving their own individual issue that has prevented them from succeeding in the past. One of the advantages of being involved with the national societies, as I am, is that I get to hear about all of the cutting edge science before it really percolates out into the media. And some of it, of course, ends up not being true. People predict all sorts of things will happen that don't necessarily happen. But I have seen many advances over the years. Here we are in the early 2020s, and we are now at the stage where we can evaluate both the uterine environment for embryo implantation and also, more importantly, the health of the embryo. So pre-implantation genetic diagnosis is a amazing new advance that has been percolating really for easily 30 years. And it has now come to, I'm not sure that it's perfected yet, but it has come to a very high level in terms of being able to predict which embryos are likely to implant and which are not, and also which are and are not carrying a particular disease that a particular couple may not want to pass on to the next generation. So I'm very excited about the genetic analysis of the embryo and what we are able to do in the laboratory. The field continues to advance, and it advances at a very rapid rate. In many ways, I see the affiliation between USC Fertility and HRC Fertility as creating a total that is greater than the sum of its two parts, because we have taken what was best about the academic practice of reproductive endocrinology and infertility, along with an optimized patient environment. And that is really what I'm hoping we're going to achieve here. I'm Dr. Richard Paulson, fertility specialist practicing here at USC Fertility and HRC Fertility, and I look forward to having the opportunity to help you resolve whatever fertility issues are standing between you and your dream of completing your family.